If you looked at the shelves for a turmeric or curcumin supplement, you may be confused as to which one to take. In today's video, we're going to look at the best forms of curcumin and which ones not to take. Let's get into it. Turmeric is that golden spice often used in South Asian and Middle Eastern cooking. The active ingredient is curcumin, which has been found to have anti-inflammatory and antioxidant properties. Curcumin and its related compounds are called curcuminoids. Due to its anti-inflammatory and antioxidant effects, it has been found to be helpful in conditions such as arthritis, psoriasis, inflammatory bowel disease, depression, atherosclerosis, COVID-19, cancer, heart disease, diabetes, metabolic syndrome, obesity, and neurological disorders such as Alzheimer's and Parkinson's disease. Whilst plenty of studies have found curcumin to be effective for these conditions, taking just turmeric itself probably won't help, as only about 3% of turmeric is the active component curcumin. Curcumin itself has poor bioavailability, so only very small amounts get absorbed by the body. It has low water solubility, doesn't pass through the intestines well, isn't stable at an alkaline pH, and is very quickly metabolized. Manufacturers have come up with various formulations to help increase the bioavailability of curcumin. Let's break it down into the 3 different generations. The first generation formulations work by inhibiting or delaying the metabolism of curcumin. Ingredients such as piperine, this is the active ingredient in black pepper, turmeric oils, turmeric fibers or fish oils are added to the curcumin to improve bioavailability. The first generation formulations have been around the longest, so have had the most clinical evidence. The problem with some of the first generation formulations is that these ingredients may lead to an increased risk of toxicity. There have been a number of cases of liver injury in those taking curcumin, particularly with black pepper. Now, the evidence regarding toxicity isn't conclusive, and just keep in mind that curcumin itself has also been found to improve liver disease. Some of the names of the first generation formulations include BM95, piperine, and curcumin starch. The second generation formulations use synthetic emulsifiers in nanoforms. They increase the plasma levels of curcumin by being present as conjugated metabolites. This means that curcumin is present by being attached to another molecule. Although it appears that these forms do increase the curcumin levels in the body, the problem here is due to the size of the metabolites. It doesn't get into the cells well, it is unlikely to cross the blood-brain barrier, and is quickly eliminated by the kidneys. There are, however, numerous studies showing the efficacy of the second generation formulations. Some of the common names you'll see are Merova, nanocurcumin, therocurmin, hydrocurc, and lipocurc. The third generation formulations have curcumin in its free form and aren't attached to other molecules, so have increased bioavailability, are able to get into the cells and tissues in the body better, and can cross the blood-brain barrier. This is the best form to use to ensure good absorption into the body without the risks of toxicity. You definitely want to use this form if you are taking curcumin for mood and neurological disorders, as it enables the curcumin to pass the blood-brain barrier. There are, however, not as many clinical studies on the third generation ones, as they are much newer. Some of the names you will see include Longvida, Curcumin, and Curcumin Ultra. Another way to increase absorption is to take your curcumin with some fatty foods. Curcumin is fat soluble, so taking it with about 15 grams of fat can increase absorption. You can also take curcumin with a pinch of black pepper rather than having it included as an extra ingredient in the supplement. Recent evidence shows the third generation formulations to be best in terms of bioavailability and safety. The first and second ones, however, have had an abundance of clinical trials looking at their efficacy, so you probably can't go wrong here either. Just be careful if you have any history of liver disease, and if you want to err on the side of caution in this case, then avoid the combination of curcumin and black pepper until more evidence comes to light. So that's it today on the various forms of curcumin. If you found anything useful, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!